One thing is variety. We let you practice the kind of medicine you want to practice, and in a lot of ways, the way you want to practice it. You can do as much or as little with your career as you want.
For me, it's the fact that we are physician-led group practice, so that's really important that we are always in a position of leadership where there is a medical perspective always being considered whenever there's any changes that are happening throughout Ochsner.
At every single level, we have physicians making decisions that impact other physicians.
But probably more than anything, I appreciate that I have a connection to the system, and I have connectivity that has been allowed to me by being part of Ochsner.
I would say that it's really the people that work together in a lot of different roles, and you really can't succeed unless you have that good medical assistant talking with the patient or rooming the patient, the nurse, and they really care, and they really do put the patient first, and they really know their history, their whole story. It's kind of like a family.
As physicians, we all feel like we have a calling, and we certainly do. As primary care physicians, we probably feel that calling a little bit more strongly. It is important to be in a place where you can give your patients what they need, but also build a life that you want.
Louisiana culture is always so unique. You cannot go to any other country, you cannot go to any other state and get the same thing you get here in Louisiana. Whether that be beignets, whether that be Mardi Gras, whether that be gumbo, jambalaya. Many people try to imitate it, but it's never the same. You can only get that authentic culture here.
I feel like I am living the dream. Working with people who love what they do, taking care of patients who are incredibly appreciative of the time that we are offering them, and also being able to be here and build a family in a community that I love.
The piece of advice I would give to anyone is be open and willing to collaborate with other team members, such as other physicians, other APPs, our nursing staff, our MAs, because everyone's viewpoint and opinion helps to create a better environment for our patients.
If you have an interest in one of these areas and you want to focus your practice, by all means, kind of draw that up, create that in your mind. And then as you're seeking employment or looking for a home, use that as your guide.
I would say the most important thing would be talk with the providers, the physicians, the PAs, NPs, the nurses, the staff, really, what they love about the place, and do you match well? Because I think there's a lot of different cultures, different personalities, and I think they all work well, and you want to fit well with the group you're in. So it's really the people, not the place. And they're your family.
My advice would be to find a place that you feel home so that you can do what you do and do it well.